Good morning, everyone. Welcome to today's webinar, Direct Primary Care Unpacked, a modern approach to employee health, presented by Charlie Parker. And before Charlie introduces himself, I'd just like to go over a few housekeeping items. Today's webinar is being recorded, and the recording and the slides will be shared with you via email by the end of the week. Additionally, this webinar is certified for one SHRM and one HRCI credit, and those credits will be shared at the end of the presentation today. If time allows, we'll have a Q&A session at the end of the webinar, but please feel free to type your questions in the chat feature as they come up, and Charlie will address them at the end of today's presentation. If he doesn't get a chance to get to all your questions today, he'll personally follow up with you to get you your answers. There'll also be a brief survey at the end of the webinar, which we'd really appreciate if you could stay on for a minute or two and fill out, since we're always looking for ways to improve our webinar experience and new topics and ideas for future webinars. And now I'd like to turn it over to one of my favorite presenters here at HG, Charlie Parker. Take it away, Charlie.
Thank you, Rachel. Hello, everybody. Thank you so much for joining today. Like Rachel said, my name is Charlie Parker. I've been an employee benefits consultant at Hausman Group for about 5 years. Work with a range of employers, all different sizes, and a range of self-funded clients and fully insured clients. Clients that use direct primary care, clients that don't. So wide range there. So I'm a direct primary care user myself, so I'm really passionate about this topic. I'm excited to share how it can look for employers. So before we get into just direct primary care itself, I just want to start by touching on some of the reality of healthcare today. It's been following this consistent pattern for so many people and so many employers. I'll start with just the time to get in for patients. So the wait to get in on average is about 31 days just to get an appointment. And from what I've heard from so many people is 31 days would be reasonable. I have a coworker who's just got scheduled out for April. So the range and the wait to get in is vast. So when you do get in, those visits, especially for primary care, are typically very short. The range is anywhere from 13 to 24 minutes. And in a lot of cases, you might even see a sign on the door that says these visits are limited to a maximum of 20 minutes. So that visit is pricey as well. So when you finally get in, the direct primary or the primary care visit, it ranges from $100 to $170. That's the sticker price. Urgent care visit will be $150 to $280 per visit. And if that escalates to an emergency room visit, that can range $3,000 or more. So what we're seeing in healthcare is long waits, short visits, rising costs, poor access. And this has just shaped how people experience healthcare today. It's how people use a traditional system. And in many cases, it's how people avoid or why people avoid the traditional system. So direct primary care was really built to solve a lot of those concerns and those issues for people. And it's really a great starting point to changing the healthcare experience. So my goal today with this direct primary care presentation is really just to give you an understanding of what direct primary care is. Share a little bit about why it's grown, why it's working, why it's being considered. And then if you know Hausman Group, you'll know that we'll talk about the 4 C's. So that's cost, compliance, communication, and creating efficiencies. Any strong benefits package or any strategy when looking at your benefits has resources and strategies around cost, compliance, communication, and creating efficiencies. So we'll talk about how direct primary care fits into that. We'll look into direct primary care if it's a fit for your organization. Maybe you get through this and you find it's a fit for you personally as well. And then I love telling stories about direct primary care. We'll wrap up with some stories, make it a little bit more real, share the experiences that I've had as an individual, but then also with some of the clients we work with. So with that, before we go further, Rachel should send a poll out just to get a sense of the room, want to understand what our familiarity is with direct primary care. Where are we at with this?
All right, Charlie, looks like the poll results are coming in. Are you able to see them?
I am, yeah, thank you.
We'll give everyone another second or two to put their answers in, and then we'll keep moving on. All right, there are results.
Okay. So a good range of familiarity is what I'm seeing. So some that are not familiar at all, some are very familiar, and the majority that fall in between the two. So hopefully with this, you get something out of it if you're very familiar. If you're not familiar at all, I really hope that this provides that foundation for you. So thank you for answering that question. Good to go, Rachel?
All set.
Cool. All right, so primary care, direct primary care. Let's just start with the foundation of truly what it is, right? At its core, direct primary care is very, very simple, right? But it's fundamentally different from what people experience in the traditional healthcare system, and different than what people are used to. It's structured in a different way too. So these are private, independently held primary care facilities. So they're built by physicians who have stepped away from the traditional market, the traditional system, and have built something for a better patient experience. That was the goal, and that was the reason these direct primary care facilities have started to pop up. So the reason they did this, the reason the move away from the traditional system is something that we all really know and experience, but the traditional system is driven by volume. More patients, shorter visits, a referral source, right? Not to mention the insurance companies involved as well. So there's the money aspect of it, but all of these hands and all of this volume and all of this interaction with the traditional system has really disrupted the patient and doctor relationship. And when it comes to primary care, especially, or your health in general, that patient doctor relationship really should be the only one that matters. So, direct primary care, what they do is they operate completely independent from insurance. They remove that volume driving philosophy completely, which gives doctors back their time. And when doctors have more time, their patients benefit. So, this is why this was built. And if you see my picture up here, if you've seen the movie Field of Dreams, the way that I think of direct primary care is really old fashioned care, but powered and using modern medicine, right? Old fashioned care powered by modern medicine. So, again, direct Field of Dreams, Dr. Archibald Graham, Moonlight Graham, had this little office on the side of Chisholm, Minnesota, and was known for the compassion and the care that he provided to the town. Direct primary care, it feels like that to me. It removes all the complexities, the insurance, the billing systems, and really brings back healthcare to a patient-centered care model. So that's the structure. We'll talk a little bit more, or that's a concept, and we'll talk a little bit more about the structure. Direct primary care, like I mentioned, is really designed to put the patient and doctor relationship back at the forefront. And that drives everything that we'll talk about today, and that drives the outcomes of direct primary care. So this relationship isn't just a clinical relationship, but it is a financial relationship as well. So instead of billing, instead of insurance, the contract and the direct financial relationship is with the provider or the practice and the patient. So what this looks like is patients or employers on behalf of their employees. What they do is they pay a simple monthly membership fee, and then return for that fee, they get unlimited access to primary care and the services that that clinic provides. So there's no copays, there's no fee for service charges that occur, and all of the services that you get through a direct primary care clinic, they do not run through insurance. They're not paid for by insurance. So it's completely separate. This model was designed really to just remove all that headache, and just create this direct relationship that has consistent access to care for their patients. So who has access to this, right? And the good news is it's very flexible. It's not designed to fit just employers or just certain size employers. It really can benefit anybody who wants that different healthcare experience. The two ways that I see individuals interact with direct primary care is first through an employer, and that's as a part of the employee benefits package. So this is available as a fully sponsored plan. This is available as a voluntary plan. There's tons of ways to design this to fit your employee base. This is really important to take a close look at if you are thinking about implementing this as an employer, because there's tons of avenues and ways that you can go about implementing this and helping it create value for your people and for your company. So I know that's high level and there's a ton that we can get into, but it's can be offered through the employer as a part of the employee benefits plan. Individually, and this is how I became a direct primary care member, individually, you can go online, you can find a direct primary care provider that's nearby where you live, and you can sign up and pay the membership fee yourself. Anybody can really enroll directly. There's no limitations to this. So it can be your family, it can be yourself. This access really is there for everybody and can work for anybody who's just looking for a different experience than what they're used to with the traditional system. So let's take a look at how it operates day to day, right? At the simplest model, at the simplest way to put this, it's a membership, right? You're typically paying a membership, and that cost is anywhere from $30 to $150 a month. And that depends on if it's provided through your employer, that depends if you're a child or an adult, and it depends on your age. So it's age bracketed, similar to what you would see like a voluntary life insurance plan or something like that. But it's very simple, it's very straightforward, and there's prices available on every direct primary care's website. The reason they structure it this way is, again, just to remove all the burdens and to remove the volume aspect of the traditional system. So the direct primary care providers, they get paid this membership fee, and in result, they give unlimited access to care. What this also does is allow physicians to structure their practice in a very different way. The biggest thing that it does is help them monitor their patient panel. So in the traditional system, what you'll see is a physician will have anywhere from 2,000 to 2,500 patients. Direct primary care, that number comes down to 300 to 600 patients. With primary care, what you'll see is a doctor will see about 1% of their panel a day. So in the traditional system, that's 25 patients. In the direct primary care model, that's anywhere from 3 to 6. And because of this freedom, direct primary cares are built around that unlimited care, that no copays for care, and the direct access to the clinic. So you'll literally get a phone number or an email to your provider that you can contact at any time directly. To break this down a little bit further, another way to think about this is very similar to like a gym membership. You pay a monthly fee, you get unlimited access to the gym, and you can use that gym however you want to support your needs and your health. Direct primary care works very similarly. Pay the membership, you get access to care. An important thing just to understand is just like your gym membership, direct primary care doesn't cover everything, right? There are times that things need to go outside of the direct primary care practice. Direct primary care does cover about 70% of most people's needs, but when things need to be done outside of the practice or there's external things that need to be done, there will be additional costs that come with that, and I'll touch on that a little bit more on the next slide. So when services are requiring any external resource, but they can be done within the walls of a direct primary care clinic, and this is like certain labs or imagings or medications, they're still delivered and you can still get them through your direct primary care provider. but they're delivered at significantly reduced and transparent costs. So on the screen here is from one of our partners, and they literally post their prices right online. So you can see what everything will cost in comparison to the retail price if you were to go through a traditional system. So very, very transparent, right? And these examples, they all come with additional costs, right? But it's shocking at the price difference between the two. And the common question that I get is, how can they do this? How can they afford to do this, right? Why is it such a difference? The answer really comes back to the membership model. It comes back to not having to answer to anybody, not having to have these increased costs or layered markups or anything like that. So these prices that they provide, when they can provide a service in house, they're provided at wholesale cost. So even if something isn't directly included and covered in the membership fee, there are still plenty of things available that are offered at a simple and much more affordable cost. Okay, so I mentioned that direct primary care covers about 70% of most people's health needs. So a common question is, what happens if I need something that is beyond primary care? And direct primary care can address a ton of day-to-day healthcare concerns, healthcare needs, preventative care, routine issues, condition management, and urgent concerns. But obviously, health doesn't stop there. So common question that I get is, what happens if I need a specialist or a referral to a specialist? What your direct primary care will do is they'll help you coordinate that referral and guide you to a high quality, cost effective option. So they can assist in that coordination of care if it leaves the walls of direct primary care and really help communicate to that next provider that you go see what is happening in your life. After hours care is a big one because typically what you'll see is that primary care clinics will run somewhat similar to normal business hours. But one of the strengths of direct primary care is that ongoing access to your physician, that 24/7 access. So care doesn't stop when the office closes. Doctors are on call, they're available on weekends. If something comes up in the middle of the night, you can reach out to them, you can go into the office then. And in some cases, they can even come to your house. So there's a digital world that they can help with after hours. They can come to your house in some cases, or they'll meet you at their office. Outside imaging or lab work. So if something falls outside of the scope of the direct primary care clinic, they can refer you to partners that they have. So I know a strong partner that some direct primary care clinics have are certain MRI and imaging centers. So if you don't want that to run through insurance, your direct primary care provider can help navigate that for you. They really can manage that care to direct you to the lowest cost option. This is something that I can talk a little bit more on, maybe on the next call, or if you have more questions on this, but employers will structure this in very unique ways. So they'll structure it if you go to a partner that the direct primary care clinic recommends, a lower cost option. Sometimes employers will structure their plan that is 100% covered to the employee because it doesn't hit your insurance plan. So there's a lot that you can do with that that can really benefit you as a company. And it benefits your people as well. So more complex care, surgery, any catastrophic event, what happens there? This is where insurance still plays a critical role. So I'll talk a little bit more about that, but direct primary care really isn't trying to be everything. They're trying to be the correct starting point for people. So it handles the majority of that routine care. It helps provide guidance to your people, and they'll help with the follow-ups that happen after a major event. And so instead of being left alone or instead of trying to navigate this confusing system on your own, you do have someone in your corner, and that's a direct primary care provider. So to expand on insurance playing a role, direct primary care is your medical home, but it's not for major medical events. Insurance is still essential for the big, unpredictable, high cost events like hospitalizations or surgeries or specialized care. So direct primary care, it sits alongside or in front of your traditional insurance plan. And the direct primary care improves how people actually use their plan by offering that day-to-day high access experience. Where insurance comes in is they provide that financial protection for when something serious or high cost occurs. So when it comes to pairing the two, if you're an employer that's considering this, when it comes to pairing the two, that's where things start to become a little bit more specific to your employee base and your company and how that structure is integrated with your plan and with your employee benefit offering. That is something that I would recommend just working really closely with a partner and a consultant on to make sure it's structured in the proper way, pointing in the right direction. And I'll talk a little bit more about that as well. But I'll break down what this looks like more in practice. But just to kind of level set with everybody, it is a deep topic. It can go beyond what this presentation will cover today. So today is surface level, but hoping to give you a lot of information on what that looks like and a clear framework for possibly implementing it in the future. So why is direct primary care gaining traction right now? Why are we giving presentations on it, right? And the answer is because more and more people, physicians, patients, employers are just looking at the traditional system and thinking, this isn't working, right? This isn't working the way that it should. Costs keep rising, access is more difficult, and the experience for a lot of people is feeling impersonal. And so, what direct primary care is doing is bringing healthcare closer to what people actually want it to be. And that's why it's being considered so heavily. I think the growth of direct primary care is important to highlight because the momentum of this truly matters because it's telling us it's not a niche concept anymore. It's something that is truly becoming more legitimate and mainstream. It's not just for the one-off people. It really can be for anybody and for any employer. I think the growth really reflects that people are looking for a different way to experience their healthcare. Okay, so from a patient perspective, um, the growth from a patient side of things is growing for a few key reasons. So first, there is the access that I've talked about. This is the first barrier that comes down when people are exploring direct primary care. People actually start receiving care timely. There is availability to get in, and that alone has been a huge shift for people and brings a ton of value. The second element of growth is the time and communication you have with your doctor directly. Patients are no longer trying to squeeze in concerns into this rushed visit. An appointment will last 30 minutes to an hour with an average of 38 minutes compared to that 13 to 20-minute visit that you would typically see. The third barrier that comes down is the financial one. So a lot of people hesitate to go in and get care because of all the uncertainty that it brings. They're not sure how much it's going to cost. They're not sure if it's worth going for that cost. And they're not sure if they'll walk away with any answers or any support on what they need to do. So with direct primary care, that really starts to fade away. It feels much more approachable to people, and it stops becoming a burden to go into the doctor or to schedule an appointment. So one thing that I will bring up, and I think it's important to note that from a participant perspective, there is the hurdle of changing your doctor, right? Healthcare is super personal. People have these connections with their current primary care provider. And so making that change is not always easy. What I will say is, in our experience, once this model rolls out and once people understand that they have all these benefits with direct primary care, it makes that shift a lot easier. But that initial feeling can definitely be challenging. Okay, so let's look at this through the employer lens. At the start, at the highest level, direct primary care is not just about adding another benefit line. It's truly about offering a solution to a frustrating system and providing something for your employees that people will value and appreciate and use. As a business, direct primary care, it also creates this opportunity to influence and control cost. They do this through reducing the unnecessary usage. They do this through stabilizing claims and managing health conditions of people, right? And the idea of this is that when these things occur, when people use it, when people manage their conditions, this will drive down costs over time because less is hitting that insurance plan. Employers are also looking at direct primary care just because it's designed to be a positive influence, right? They're a steward to employees' health, they're a steward to employees' pocketbook. And with that, they become a steward to employers' spend, making sure just the right care happens at the right time, and it's at the right cost. So, Hausman Group, you know Hausman Group, you know everything runs through the four C's, right? Cost, compliance, communication, creating efficiencies. And when considering direct primary care, those four areas are critical. It's important to understand how direct primary care falls into all four of these buckets. So I will talk through each C, starting with cost, because for most people, cost is that top priority. Starting with the upfront cost, there is that membership fee. And again, this is not about removing one item and swapping it with another. It's truly an investment into direct primary care and an investment into your benefits plan. And the way you structure that will influence the way that it aligns with your total benefit spend. From an employee side of things, it's pretty transparent, especially if you are offering this as a fully sponsored plan for your employees. Primary care services are included, additional services are available at very transparent pricing and low pricing. So, what this means for the employee is that it's less out of pocket cost for the individual on a regular basis when care is received through the direct primary care provider. From an employer side, controlling costs come down to two common ways that I see within the insurance plan. And that's frequent claims, but also high cost claims. Direct primary care can influence both. When it comes to frequent claims, this is where we see the most impact upfront, especially. But direct primary care is designed to provide a reduction in primary care visits, specialist referrals, procedures that happen in the hospital, urgent care visits, emergency room visits. Those are all frequent visits. When they happen through direct primary care, they do not track towards your insurance plan. So, especially if you're self-funded, all of those visits, there's no payments that are made that track towards your out of pocket as an employer. When it comes to influencing the high cost claims, the key component of this is catching things early, that early intervention. So when high cost claims are caught early within those frequent visits, it can make this impact on how expensive the claims will be in the future. Waiting for care until something becomes significant is going to be more costly, more disruptive. So catching this early can influence the total cost of that high cost claim. It is important to note on this last bullet here, self-funded versus fully insured. This impact when it comes to cost does have a stronger influence with self-funded plans because when the claims experience has a direct correlation to the insurance spend, that is where you can see an impact. With fully insured plans, if I'm talking to a group under 50, the conversation is geared more towards access because those groups are pool rated, they're age rated, and the impact on these items, the impact on the high cost claims and the frequent claims do not correlate as directly with a smaller group. If you're fully insured and you're over 50, this can create an impact, but it depends on size, at how much impact that's going to make. So that's important to understand, depending on where you fit, where you align with your size, with your funding mechanisms, and what impact this is going to have on cost. So talking about direct primary care and breaking it down into the areas that this can influence cost, what we see is these four buckets drive the majority of the upfront cost control. So we talked about this already, but it's those diverted claims. This is the frequency. Those are the services that would normally hit your insurance plan, but instead they're going through direct primary care and handled completely outside of insurance. They do not count towards your claims experience. Second area that we see is the avoided claims. This is the middle of the night emergency room visit. This is the emergency room visit when you just need to go see someone in the hospital or when you want to go see a primary care provider, but you can't get in, go see the urgent care emergency room. This helps avoid all of those claims. So that in theory will help your experience and your rates. The third, and this one is a little bit harder to quantify because there's some unknowns involved, but the health improvement asset, the health improvement asset aspect of controlling costs. So it's harder to measure, right? But when care is easier to use, preventative care actually happens, chronic conditions are identified earlier, patients can be monitored and go in more consistently. And over time, that will have an impact on the total health of your group. The health trajectory will relate in the claims trajectory. In theory, that brings the cost down. The fourth, and this is really geared towards self-funded plans, but it's the reduced administrative need, the reduced utilization management spend. If you're self-funded, you know that you have PBMs, TPAs, you have all these external parties that you may pay for to help manage certain conditions that are happening within your plan. With direct primary care, there's less of a need for that because the DPC facility will become your quarterback for everything, for guiding care, coordinating decisions, and helping patients move through the system more effectively. So when we talk about direct primary care creating value, we're not just talking about one thing. We're not just talking about access. We're not just talking about helping people stay healthy. There's a range of things that really drive the cost savings area to make this a meaningful experience for both patients and employers. Okay, so when you quantify that, when you look at those areas I talked about earlier, this is from a Milliman study, which shows the value that direct primary care can create for the average employer. It also shows the average cost that an employer would pay towards a monthly membership fee. They're both $85. So what Milliman is saying is that there's a break-even point early with potential upside with health improvement and product quality. It is important to be very clear here because I've heard this presented in many ways. It's not a guaranteed cost saving strategy. And I'm sure there's people that will argue that on me, but I don't believe it should be sold that way. It can be a lever for the future. The theory is that it should be a cost saving strategy, but it depends on how you look at it, right? Is it a year basis or is it a 10-year basis or is it a 20-year basis? How are you viewing this? And that is the way that you monitor whether or not this is right for you from a cost saving perspective. What I've seen is that this better access that direct primary care provides, it might actually uncover some needs that have gone unmanaged for years. Those needs may be chronic, right? Conditions might be diagnosed and they get pushed towards the major medical system. If this happens and those claims hit your plan, you might see an increase in self-funded spend, in renewals. But on the flip side, those are likely being caught earlier and will be managed in a better way moving forward. So it's important to understand that when looking at this from a cost savings mechanism, is that it may not be an upfront cost saving story, but in the long term, it should help. Okay, let's shift into the second C, compliance. So as promising and as great as direct primary care is, it does still need to be structured correctly. So when we're offering a direct primary care, again, it must work alongside of your medical plan. And the progress in that has been positive, right? Especially in this last year with the HSA compatibility rules. There's deeper compatibility with certain types of plans, especially HSAs and utilization of HSAs. And that's something personally that I'm happy about because I want to be on an HSA plan. I want to contribute to my HSA account, but I also want to use those funds to help me with my direct primary care out of pocket expenses. This is something that wasn't available in the past, but now is, which is growing the the attractiveness of direct primary care. The other thing I'll mention is just because this is developing at a rapid rate and it's growing in popularity, there are still gray areas that exist in offering direct primary care alongside of your traditional plan. So this is where it becomes really important to make sure that you're integrating this plan the proper way, that you're working with a compliance expert, working with somebody who takes that seriously, and documenting all of what you're doing. It shouldn't scare anybody that there's gray areas and that it's an ever-changing area, right? But just something to keep in mind and something to be aware of when looking at implementing direct primary care. Next C is creating efficiencies. So one of the most practical strengths of direct primary care is the efficiency it can create for both the patient and the employer if it's offered as a part of the employee benefits package. What direct primary care does is it gives just this clear point of entry where people have a provider that they know, a place that they can go, and someone that can easily be contacted. So for employers, what this means, sorry, for employees, what this means is that there's faster guidance, there's less confusion, and there's just more all around support with your actual doctor, with the one that knows your health. For employers, what this can do is reduce escalations that happen within the insurance plan. We've all had billing issues. We've all had provider concerns, right? It limits all of those because your employees have a direct point to go. And it's very, very clear that that direct primary care is the medical home, right? It is important to understand the limitations to this as well because access can vary depending on the spread of your group, depending on where you're located. Direct primary care clinics are popping up all over the place. And so the footprint is expanding in that sense, but depending on where your company is, depending on where your people are, to have this implemented properly, we need to make sure that there is a facility nearby that is easy for people to use. The plan as a whole needs to be well aligned with your benefits ecosystem. It needs to create efficiencies for both you and your employees, and structuring that properly is the number one way to do that. Final C we're talking about here is communication. So this falls in line where if you are rolling this out, if you are looking at implementing direct primary care as a part of your strategy, it really needs to be nurtured and well addressed in a strong rollout plan because employees need to know what direct primary care is. It might be a completely new concept to people. So people need to understand how it works, how it differs, and when and where they should use it. So the one thing I'll talk about too is the first appointment. That first appointment is so, so important because once people use direct primary care, the value truly becomes real. People see how it's different. People see how they interact with their doctor and go, hey, I've never experienced this before. So then people start talking about it. I know I've talked about it. I am an insurance guy and a health guy, but I talk about this all the time. I talk about it at dinner with my friends and say, this is a crazy thing. It's so cool, right? I have this great interaction with my doctor all the time. And that's the other element of this communication is that conversation that you can have with your doctors. The communication from the employer is very important, but just as important is the communication with your provider. And when those two things happen, employees have this great experience, they understand what's going on, and they can use it effectively. Okay, so at this point, we've talked just about what direct primary care is, how it works, how it fits into those 4 C's. So now I want to talk about just is it the right fit for your organization and how do you evaluate that? The first place to start is really with your employees. So would direct primary care be solving issues for them? In a lot of cases, the answer is yes, right? But will they engage? How will they take this on, this new concept on? Will they change their doctor, right? How will they adapt to this new model? What will the overall response be? So You know your employees best, employers who are on this call, you know your employees best. You know how they'll take on to something like this. There's a range of how people accept this philosophy or this change. And so understanding that, having the right rollout plan is very, very important. What you do after that is you look at your organization. Does this model fit your population geographically? That would be the number one thing to look at. Where are there quality direct primary care providers available in your area where your employees work or where your employees live? And then are you willing to invest upfront in that membership fee? How will you structure it internally? Will individuals be paying? Will you be paying for them? How will that structure look? Will you be paying for those additional services? There's tons of ways that you can look at this, but it all needs to work within your organization. Understanding your employees and understanding your organizations is the first step to if this will be a good fit for your company. If you get through that, the next step is really taking a closer look at your plan because your health plan and your direct primary care plan should point in the same direction. You need a plan that a traditional health insurance plan on top of your direct primary care, but that traditional health insurance plan should direct a behavior change and adoption into the direct primary care model. We want that to be the place that people go for the majority of their care, right? So, are you willing to do that? Are you willing to make a plan alignment to match your direct primary care strategy? The second thing that you should look at is your data. Where are the pain points today? What are you seeing in those avoidable claims or the preventable activity? When you look at your data, is there areas of that chart that chunked out the diverted claims, the avoidable claims? Is there areas in there that can be influenced by putting in place a direct primary care provider? The third point to take a look at closer is just being realistic about the progress. It's not always an overnight fix. There's work that needs to be done. It's not always a guaranteed savings. So this process might take a little bit of time, right? Be realistic about the progress, be realistic about the engagement. And are you willing as an organization to support the outcome that you're hoping for? Finally, and this is probably, I would say this is the most important area of if you're implementing direct primary care is to understand your intention and define your why. So what is the goal? What is the goal of doing this for your people? Is it for the company? Is it for cost savings? Is it for the people? Is it for access? Is it for a combination of things? Understanding how you shape and design your plan, your DPC plan with your insurance plan, how you communicate it, how you measure it, and how you support it over time is very important. Understanding why you're doing that is the first step. Once the intention is clear, once you know why you're doing this, the next step is committing to that strategy. Organizations that get the most out of a direct primary care strategy are ones that treat it as a true strategy, right? They invest time in it, they commit to it, and they support it throughout the years. Okay, so we've talked about the structure, we've talked about the strategy, we've talked about the cost, we've talked about what to consider. At the end of the day, healthcare is personal. Before I wrap up, I want to just share some stories. Again, I love telling stories about direct primary care. My fiance is probably sick of me talking about it, but I I think it's very important to give real life examples. So I have three stories here that I'd like to touch on. The first story is a personal story. So this was my direct primary care adoption. I'd been with my fiance for about 6 years, and she said, "Charlie, um, when was the last time you went to the doctor?" So I don't know, probably when I was playing high school sports and I needed to get, a physical to be eligible to play or whatever it might have been. And she's like, "That's not okay. You need to go in, like go get checked out." Right. So I went online, I went through the whole thing, and I went through this list of providers, and I just felt overwhelmed. I felt like I don't even know where to go. I don't know who to go to. I don't know or trust any of these people. They're doctors, they're all great, right? But it just was this feeling of uneasiness and this overwhelming feeling. And so what I did was I thought, hey, I had heard about this direct primary care. I drive past one every day to work. Um, I'm going to check this out. And so I signed up, I scheduled an appointment for the next day, and I went in, I got all the routine stuff done. And then the doctor sat down and she said, "Hey, let's talk about your diet. Let's talk about your sleep habits. Let's talk about all of the things that really drive health for most people." And she sat down, slowed down, and I had this interaction that I was shocked about. She's asking me about certain foods that I eat and all these things, right? I ended up getting some blood work done, and that blood work cost was $70. I had a friend that went through insurance that did it at a similar time. It was 1,500. So this experience, this ease, this simplicity, the care that I received, I was a fan for life after that. And that's why I talk about that first appointment being so important, because once you see that, you really can feel the benefit that you get. So that's my story. The next is a client story, a client that implemented direct primary care after an experience that they had. So something came up in their personal life and they needed to go and see a doctor. They couldn't do it virtually. They didn't want to do telehealth because what they needed required that personal touch. So they had called and said, "Hey, I need to schedule an appointment. Sorry, we can't get you in for 5 months." Right. And so what do I do? Well, you probably should just go to the emergency room. They'll get you in today. Right. Like we talked about, that's a $3,000 charge at times. So the person went to the emergency room because they were concerned and they needed somebody to see them. They went in and everything was all good. There was no concern that needed to be addressed any further. So we get a call and the client said, "This needs to be different. I can't have my employees going through this experience. That was terrible. I had to go into the emergency room, didn't even need to go. I know you've been talking about this direct primary care. I think it's time to implement that. We need better access for our employees. We can't have people going through this experience." So right then and there, we implemented direct primary care for them. And their reason for doing this was to provide better access for their employees. They were concerned about cost, as everybody is, but their number one concern was providing a better plan for their employees. And that's what it did. The third story I'll talk about is one that I touched on earlier, and that's the price of engagement, right? And so there's another client that we had that said, "We have low utilization. We want to provide something for our employees. We want to implement this direct primary care. We're self-funded. So we want that to be the medical home for people." And they pushed it and they communicated it. And we saw their engagement in receiving health care skyrocket. It was awesome. With that, there were needs that were not addressed for many years that needed to be addressed. So this was a large group. I believe it was 5 high cost claimants came out from that engagement. So individuals that had over $50,000 worth of claims that previously had next to nothing. That drove the price up. That drove their insurance rates up. Having those high cost claimants hit the plan from a simple cost perspective is not ideal, right? So we had to take a step back and take a look at really why we implemented this plan. The reason why we implemented this plan was to help our employees, and this helped our employees. Yes, there was a cost increase. I would like to think that cost increase was not as critical as if those conditions were to wait and they became even more severe. So there can be a price hike at some times, but again, it's understanding the intention, understanding why you're doing it, and why you're bringing direct primary care into the picture. Okay, so I'll bring that to a close. I'll answer some questions. I hope that you got an understanding of what direct primary care is, how it works, why it's gaining traction, but really bringing it back to that patient-centered care model. That's what direct primary care does for so many people. Thank you all for listening. I know there's some questions that came through in the chat, and I will address those in the next few minutes here.
Great. Thanks, Charlie. While you're typing in your questions in the question and answer feature or in the chat, you can go ahead and also check out the CE credits if you're using them for SHRM or HRCI. We did have some great questions come through already, so I'll just start going through them for you, Charlie.
Okay.
One is, can DPC be offered with an ICRA?
Uh, yes, it can. So an ICRA is, again, an insurance policy, and the direct primary care is separate. So it can be a way to structure that. ICRA is your insurance section, right? That's the insurance bucket. The direct primary care is a separate bucket. So again, how you structure that all changes, but they can be offered together.
Great. And I do believe you addressed this a little, but I think it's worth reiterating. Where are doctors located, and do employees have a choice of physician with DPC?
Sorry, one more time.
Where are doctors located, and do employees have a choice of physician with a DPC?
Yeah, so there's a handful of different direct primary care facilities that span across the state, span across the country. There's different ways that, again, employers structure this. So if I'm an employer and I have somebody, if I have offices in Wausau, in Milwaukee, in Madison, I can connect with local providers in that area. And I can have my Madison folks go to Advocate MD, right? I can have my Wausau folks go to Innovia. I can have my Milwaukee folks go to Solstice, right? There's ways that you can structure this. How I typically see it is that the employer does set the framework of where employees would go. A lot of these providers have multiple doctors. I am Advocate MD, that's who I use. There's a handful of different doctors that I can choose from to be my direct doctor. So individuals have a choice, but it may be limited within the structure of how the plan is set up. And employers have a choice to align with their geographics and with who they see as their best partner.
Great. But the reality is they may have to switch from a primary care doctor they already have within the traditional health system.
Correct. Correct.
Great.
And
Oh, sorry, go
it,
ahead.
I will say to that, in theory, they don't have to, right? But that's why it's really important to structure your insurance plan to generate that drive and that behavior change to go access direct primary care. And so there's ways people structure this. They go, hey, if you go see your DPC provider, it's free. If you go see your standard provider that you've gone and seen in your traditional system, you structure that copay or that plan design to say, hey, you gotta pay that cost. And it might be the entire cost, it might be a portion of that cost. Again, it's really just structuring to align with what you want to do as an employer.
Okay. Thanks, Charlie. Next couple are around prescription medications. How does DPC handle prescription medications? Do users have access to a pharmacy, or sorry, do they have access to pharmacy, or would that go through traditional insurance?
So there's two ways really that I see this. Direct primary care providers, they do have in-house medications. So they can serve as a pharmacy. When you purchase drugs through the direct primary care provider, that is a cash price. And so I was talking to somebody the other day. They get a 90-day supply of whatever medication they're on for $12. If they were to go to the traditional market and get it through Walgreens or CVS or whoever, it'd be a $70 copay. So there's avenues that you can go through with that. And it's really about working with your DPC provider as an advocate for you is, hey, here are your options. I can run this through insurance. I can submit this and you can pick it up in Walgreens and you can use your card to run it through insurance. But I can source that same drug here for a fraction of the cost. It's just cash price.
And I think that answered the next question that someone was asking about if there are any discount or co-payment advantages with prescription drugs.
Yep. So just like the blood work and just like the additional services, drugs are typically dispensed at that wholesale cost.
Perfect. Good. Oh, you guys are asking a lot of good questions. The same one came through, just worded a little differently. How do we find direct primary care doctors in our area? And is there a good research to search for reputable DPC providers?
Yep. So my first step will be I would hope that the broker or the consultant that you work with has partnerships with direct primary care and is familiar with a lot of good practices. I've not heard of a bad practice out there yet, so I'm sure there's a lot of great ones, but there's resources that I can share. But there's a mapper site that outlines direct primary care facilities that are in your area. Ultimately, I would say connect with your broker, connect with your insurance partner to see what resources they have. And so then they can direct you into a model that can fit your company. A lot of times when you go that route, offering that employer sponsored plan with a partner, there's even further discounted cost to the membership.
And then last one that came in, we have employees in Wisconsin, Illinois, Florida. Is DPC available in all states?
Yeah, they're popping up all over the place. Again, that is the access concern that a lot of people have. When you look at where your populations live and work through your broker, work through the mapper site, and figure out where the areas are that align with your groups. So there may or may not be DPC clinics nearby your area. I was working with a client who was considering having direct primary care. The closest facility was, I think, 70 miles away, right? And so for them, it just didn't work. But it's something that we'll continue to look at, and something might pop up in that area. And if it does, then we'll vet it and see if it's a good fit for the company.
Well, one more just popped in. We'll answer this last
Oh,
one.
thank you.
Um,
Jesse
is
just
it-
put the one set. Sorry.
oh, perfect. Yeah.
Jesse just put the mapper site in the website. So it's mapper.dpcfrontier. So you can search the areas. It will pull up different colored dots based on what the clinic does. And you can see what's nearby your area if you're just looking for availability.
I'll put that in the chat to everyone. Here's a website that you can look at the DPC map. Thanks,
Thank you.
Jesse, for sharing that. Last one, softball for you. Do you have to be on an employer plan to subscribe to a DPC?
You do not. I always recommend being on some sort of insurance plan, but you don't have to be on an plan. You don't have to be on an insurance plan at all if you want direct primary care. Again, they're completely separate. There's really no affiliation with the two. So they act separately. You do not have to be on one to be on the other.
Excellent.
Unless your employer sets it up that way.
Gotcha. Good. Well, thank you again, Charlie, for all the great information. Thank you, everyone, for the awesome questions that came through. Charlie's happy to answer additional questions if they come up after this webinar is done. Don't be afraid to reach out to him or your other contacts here at Houseman Group. We do hope that you'll stay on for a minute or two to complete our survey. Let Charlie know how he did today. Let us know if you have other questions or suggestions for future webinar topics. And with that, we will conclude. And thank you so much for attending today. Have a good one.
1 second, Rachel. You
Oh,
got
yeah.
it. I will throw what if I put a message in the chat, will people see it?
Yeah. As long as it says to everyone.
I will put my email in the chat to everyone.
And we will follow up with Charlie's contact information in our follow-up email as well. But yeah, cparker@myhouse.com. Perfect. Anything else, Charlie?
That's it.
All right, good. Thanks, everyone. Have a great day.
Thank you.
Bye.